Hello students, and welcome to this lecture on orientation to ophthalmology. Before I take you to this orientation lecture, let's just get you familiar to the subject of ophthalmology. It is a branch of medicine and surgery that deals with the diagnosis and treatment of disorders of eye and its associated adnexa. There was a time when ophthalmology was just considered as a branch which dispensed spectacles, or a branch which did cataract surgery from elderlies. So we no longer now deal with spectacles and no longer just with adults. We have gone way beyond a tag of minor subject. From times of couching, which was done by Sushruta in the ancient India, we have come up to heads-up 3D surgery, which is very technologically and imaging-based, intriguing and interesting to all of us who are practicing ophthalmology. We are, as I mentioned, no longer just a minor subject. We were at times looked down upon as just a chashmewala doctor. We now have several subspecialities and several fellowships in these individual subspecialities. We look at each structure of the eye very individually, and there is a point where we have to consult with our counterparts and where there is one disease leading to another issue. So we have cornea, pediatric ophthalmology, vitreoretina and uveitis, ocular oncology, glaucoma, ocular pathology and neuro-ophthalmology, to broadly name a few subspecialties. We are not only dealing with clinical work or surgical work. This subject has a wide scope for research. Ophthalmology is doing very well in terms of gene therapy, stem cell research, regenerative medicine, imaging, and vascular biology. When we talk of all these, we are not just looking at the eye, we are finding other diseases that have manifestations in our eye. So there are several systemic diseases that they can be detected by looking into the eye. Earlier, we had an idiom that eyes are the windows to the soul. But I would say they are not just windows to the soul, they are windows to the entire body. Now, with the advent of artificial intelligence, there are programs or algorithms that are being written so as to study the chronic changes in the vasculature of the retinal blood vessels and pick systemic disorders. So you see, we really have come a long way from what we were way back in ancient India. Now, when I did my residency, I was at a loss to understand which topic to read, how to read it, what is important. And I used to feel so lost in the clinics also, that which surgical step needs to be done, how, what all am I supposed to know practically. But now, with the revised curriculum from NMC, we know what are the core specialities that you really need to understand. We know what is the domain of learning. We know the level that you need to know, as in know how, show how. These are the concepts that are very important that you really need to know. There are also tools that tell us that which mode is best for you to learn. You can learn by didactic lectures. There are short group discussions, or there can be flipped classrooms wherein we give you projects, you make a project, you come and discuss it with us. And I'm sure there are many times when the teacher learns from the student, because so much has changed and there is so much of content on the web that even the ones who have been experienced in this field for a very long time have either forgotten or not got a chance to learn. So you can be teachers for the teachers themselves. So the art of studying ophthalmology, although is individual to each one of us, but there are some ground rules. If we all follow those, the concepts would be better ingrained in our minds. So for that, before we start studying the entire subject, we have to plan how to go about it. We have to be really regular. I know this is the time when everybody is so much more focused into reading medicine, surgery, obstetrics and gynae, because they are quite big subjects and take a lot of concepts to remember. But if you're regular and if you try to spend even half an hour or an hour every day, you would be able to cope up with this subject. It's always a good idea to correlate the theory that you read in the lecture with some practical or clinical cases. Now, if we are teaching you cataract in the theory lecture, then you go to your clinical posting and you ask the teacher or the resident there to show you a case of cataract. Now, if they give you a case of mature cataract, you ask them, is there any other type of cataract? And then you see a case of hypermature or immature cataract, whichever is there in the OPD on that day. You come back home, you read about them and see what are the differences between these type of cataracts. What are the causative factors that are leading to maturation of a lens? So you need to see and clinically correlate whatever you are reading. Whenever you are making notes, don't just pick up several books, write and scribble your notes on the side of one book, then on the other, and then on the other. And when it's the time for exams, you wouldn't really know which ones to pick up. So always make one textbook as your gospel truth. Put your post-its, highlight in that book, and make notes either from the lecture that your teacher is giving or from a digital lecture which you have just heard. Then there are some of us who are now into digital learning and are using a lot of tablets while we are reading. So you have several apps which you can use to make your notes. We have moved on from just the didactic lectures where the teacher would come, you would sit and sulk for say 45 minutes and then they would go, you get your attendance and everybody is happy. The job is not done for either the teacher or the student in that way. So you have to do a blended learning so that you get the concepts and maybe, who knows, if you are interested in the subject, you can be a big shot ophthalmologist when you grow up. So passive learning happens in clinical observerships or in a didactic lecture, but you can convert it into active learning if there are flipped classrooms. So say if I am teaching you glaucoma and I tell you, a group of you to go and make a presentation on angle closure glaucoma, and to rest of the group I tell them to make a presentation on open angle glaucoma. Now within your group you can divide anatomy, you can divide pathology, you can divide imaging and treatment, and then you get back and you tell me maybe with a dummy case scenario as to how angle closure glaucoma happens. In that way I would be an observer and I would ask you questions since you are the teacher at the moment. So that would encourage you to be so well prepared to be able to answer any question that me as a student has. Different technologies have enhanced our learning and there are so many simulators now and there are so many other tools by which you can learn in a very tech-savvy fashion. We know that this current day students are very tech-savvy and they have a very short attention span. So you can have small snippets, you can watch small videos on the web, and whenever it interests you, you can get back to them, and one thing can lead to another. So maybe say if you're watching a video on YouTube, you can find another interesting video and you can jump onto that video, and sometimes one thing leads to another. You never know. You gain so much of clinical tips from those videos that you can have a much better clinical perception in your own mind. So as I said, case-based learning or case scenarios are the way for much better retention and they account for long-term learning. So if now you don't have a case, you can look for cases in form of case reports on the net. There are several journals which are now just dealing with the case reports. You can see different case videos being operated on the net and get an idea as how to deal with a patient who has a particular ophthalmic disorder. Say for example, you had conjunctivitis this year. You had red eyes, your eyelashes were matted, but you now want to Google up and see which other entities have similar features. You come across corneal ulcer. You see that in corneal ulcer, the cornea is compromised and you get a white opacity. You immediately rush to a mirror, you open your eye wide and see, do you have a white opacity on the cornea? No, you're very happy, you get back. Now you want to see, are there any other features that you missed and they may point towards another pathology? You find that you have a ropey and stringy discharge coming out of your eye and you've been rubbing your eye quite a bit and it's just spring. So you know probably you're dealing with allergic conjunctivitis. You dig a little bit more about allergic conjunctivitis and you find that it's probably the pollens around your garden that have resulted in this allergic attack. So then you get your garden trimmed and then you put the drops that you read and probably seek a consultation with an ophthalmologist about it. So you see, one thing led to another and you were able to see the differentials of a red eye. This is just a small example. In your clinic, in addition to the basic cases that you are supposed to study, like a basic cataract, immature senile cataract, or a basic mature cataract, you try and sometimes have a look at some other cases which cater to other subspecialities of ophthalmology. These cases can be lid opener cases for you and can be the epicenter for your learning. So for example, you get a patient in the clinic who has a red eye. You tell the senior resident or the doctor there to show you other findings of this patient and you see that the pupil of this patient is irregular and festoon shaped. Now, you ask why is the shape of the pupil irregular and you are told about synechiae, which means that there are adhesions between the iris and lens. So now you know that there is an entity called as synechiae. You go back, you read about them, and then you get to know that there are two types of synechiae, anterior and posterior. That intrigues you and you try to find out in which conditions do you see either of them. You know about those conditions, now you read about those conditions. Then you are intrigued that if there is synechiae and the pupil is not getting dilated, what if I want to do a surgery, how will I dilate the pupil? That leads to another step. Now you know how to dilate a non-dilating pupil. You will read about viscosynechiolisis or you will read about the use of iris hooks. So from just one case of iridocyclitis, we have gone on to a surgical step wherein we know how to manage a patient with recurrent iridocyclitis having a complicated cataract where the pupil is not dilating because of the presence of synechiae, and you will have to use iris hooks to manage this patient. Do not have an inch deep approach. When you study just superficially, it will just take a minute for the examiner to scratch the surface and know that you just had a little knowledge, and that can be a very dangerous thing, not just for your marks but otherwise also in your career, because if you adopt this approach for one subject, you are likely to adopt this approach for other subjects also. So if you want to be a good physician, whichever branch you choose, you have to go way deep into the subject, which involves concepts and not just mugging up numbers for your NEET exam. So if you understand one thing, you will be able to address and satisfy your patient to the best of your capability. Now, before you form concepts which are superficial, it is always better to read in depth about a particular structure or entity that you are dealing with. There are several books that are available. I'm not suggesting any one book because each of us has a separate affection for one book. You can choose the book you want. Have only one gospel truth book in which you make your notes, you put up stickies, you scribble on the side and you write down important questions or you highlight as many number of times with as many colors as you want. But have one book. Also, try and read other books and keep on adding. Each time whenever I teach a class and I read the same subject which I have been reading since years, each time I find at least a single fact that is new. And that really gives me the joy as a student, because a teacher is the best student if they want to teach their pupils in the very right way. You can make learning fun, you can go beyond books. You've been born in an era which has all the tech tools. The internet is such a good teacher if you use it in the right way. There are several fun web pages which have videos, which have simulators, so you can actually have an idea of how do you make a capsulorhexis if you use a simulator for a cataract, or you can see different videos of techniques that are used. So how do you stain a corneal ulcer, or how do you check intraocular pressure using an applanation tonometry? So there are several videos for several things, and you can definitely make the best out of it. If you don't know particular websites for a particular subject, then YouTube is always there. So usually for eye surgeries, there is a channel of itube.net. I have no financial disclosures for this particular website, but it has very good surgeries. On YouTube, if you don't want to see the original surgeries, or maybe if you don't understand what is the step, you can see the animations for these surgical procedures prior to seeing an actual surgical procedure. Now you have read, you have seen videos, but actually at the end of the day, you have to write up a paper, you have to appear in a practical exam, and later on into a NEET PG exam. So when you're prepping up for your theory, there are so many topics, there are so many of them which have enumerate this or enumerate that, and there are several disease entities. So sometimes you can have a small cheat sheet of your own in which you have small mnemonics to memorize things, and you can highlight diagnostic key features. So for example, when I mentioned complicated cataract, there are two key features here, which are the breadcrumb appearance of the cataract, and there is polychromatic luster. So these are two standout points, and sometimes you can be lucky, you can have an MCQ question with these two keywords and your answer would be so simple, just a complicated cataract. When I talked about conjunctivitis and I said that you have a ropey discharge, now that ropey discharge is the keyword for vernal catarrh. So if you highlight keywords, you know the disease entity and you can write your answer based on that. Read and revise. Reading once is so volatile, it wouldn't stay. It's a good idea to revise 10 minutes at bedtime, whatever you read throughout the day. You can open your book again just 10 minutes before bedtime to consolidate. You can write on your mobile or your tablet the salient points, and the next morning when you're going to your hospital or your posting, you can just have a sneak peek at whatever you wrote in the note section of your mobile. You can see it anytime, anywhere. Digital notes can be made with certain apps like Notability and GoodNotes. GoodNotes is pretty old school, you have your own handwriting appearing there, and that gives you the feel of having written with a pen, although you're using a stylus. But these are now good tech tools, and they're so lightweight to carry. They can come in a handbag, they can come in your bag, and you can just open them anytime, anywhere. If you're traveling in a bus, going back home, you can just open them and have a quick peek at what you studied during this day, consolidate it, and save time at home. Not just in ophthalmology, but in any clinical branch, this uniform approach works when you're dealing with a clinical entity. So before you study the features of the disease, the clinical features, have an idea about the applied anatomy of the structure that is afflicted by this disease and its relevant physiology. So if I'm talking about cataract, I should know about the anatomy of the lens. I should know about the relative physiology. Why is a young person having cataract, which is supposed to happen to a senile individual? So then I would know that maybe this young person is having type 1 diabetes and there is something wrong in their sorbitol pathway. So that gives you an idea as to what to investigate, how to seek consultation from your endocrinology colleague. You need to know the pathogenesis of the disease entity that you're talking about. and then clinical features. Whenever you describe the clinical features of a disease, always start from common features first and then go on to the rare entities. Investigations are not always standard and uniform. You must know in which disease entities you have to make tailor-make investigations. So for somebody who's living in Africa or somebody who's living in United States, tuberculosis is not a problem. So for somebody in United States, you don't have to get a chest x-ray and a Montu test done when you see a patient with iridocyclitis, but somebody in Africa or coming from India, you need to get a chest x-ray and a Montu test done when you are dealing with iridocyclitis. So then, before you jump on to making a concrete diagnosis, you must know that differential diagnosis is way more important than the correct diagnosis. You must know what are the points that are going in favor or against a particular diagnosis. That way, your mind will stay active. Every time we do not get cases of one entity in similar format, the patients can have several other coincidental findings also that can make your diagnostic abilities a little scratchy. So for those cases, if you know the points in favor and against for a particular diagnosis, it would really help you in future. Then you must know the most up-to-date classification of that disease or diagnosis, and based upon that, you should provide the most up-to-date treatment that is the standard of care for that particular disease. Now, you've given a good theory exam, you have written all guidelines and all treatments, and you've given the drugs written about them and the frequency they are to be taken, the side effects of those drugs. But when it comes to practical examination, you think you did a better job at theory, but maybe you are not able to identify the clinical features in the patient that you are going to get for your practical exam. So if you have followed that uniform approach, 90% of the times you will succeed in correctly identifying the disease the patient is having. Now, practical exam matrix is different for different universities. Most universities for undergraduates give one long case and one short case. Now, long case and short case is something you get to know on the day of the examination. So sometimes you may be anxious on the day of the examination, you may miss a finding and goof up while giving that long case, short case viva. But there's one thing you know that is going to come that you have already seen before, and that is the section in which you get darkroom instruments, you get your surgical instruments, you get the drugs, and the grand viva, which is based upon certain scans or certain printouts that are put up in the department. Now, usually these scans and printouts the students have seen before they appear for the exam because they have seen all this during the ward living. So you make sure that you score your best in this section, which includes the instruments and the drugs and the grand viva. Now, once you are sure about this, that gives you a confidence that if you have achieved one goal, the second goal can be achieved very easily, and that confidence makes you fare very well even for the long case as well as the short case. Now, long case, mostly in ophthalmology, the long case revolves around lens. So you can get a cataract case, the cataract can be immature, mature, hypermature, aphakia can be there, or you can have a pseudophakia. In pseudophakia, you can have a patient with or without posterior capsular opacification, and sometimes you can get a patient who had a posterior capsular opacification but underwent a capsulotomy. So you see a variety that can come out from one entity. You should be well versed, therefore, with the cataract and the concepts that are associated with cataract and the sub-entities that are there. Remember, adult eye and a child's eye are very different. So you have to, whenever you study any branch, a clinical branch, you have to be able to differentiate between adult features of that disease vis-a-vis the pediatric features of that disease. And based upon that, you will be able to guide the parents of the child, if you are dealing with a child, how to proceed with that particular disease. For an adult, we jump upon doing a cataract surgery if the patient has cataract. But for a child, we know that the eyeball of the child is going to grow as the child grows. So the IOL power, the power of the lens that you put now, is not going to suffice throughout. So you have to make certain calculative decisions. There are certain measurements that need to be done. You have to explore the systemic causes why a child was born with a cataract. So you see, there are lots of things that are different between adults and children, and you have to keep that in mind. Whatever surgery or laser therapy is involved for a particular disease entity, you should be well versed with that. So for cataract, earlier, intracapsular cataract surgery used to be done, which was followed by extracapsular cataract surgery. Then came the small incision cataract surgery. Now we have the phacoemulsification surgery, and the latest is the femtosecond laser surgery. So if you are using an older version of a book, you will have ICC or ECC. You don't want to be limited to something that used to be done but is obsolete now. So you must be aware of what is the surgery or what are the laser options that are in trend and can be suggested. Complications of any procedure, you should know that, and the most common complications and how to address them. Eventually, when you become a doctor yourself, you know there is no surgeon who has never done a complication. Only surgeons who do not operate do not have complications. So you have to learn when to anticipate a complication, which step can prevent a complication, and if it happens, then how to deal with it. So all these are very important, and that gives you an in-depth knowledge about a long case. For short case, we get a abbreviated version from the patient. We don't have to write the entire history. We just have to document the clinical findings and come to a diagnosis. So the usual short cases that are given in an ophthalmology exam include some lid lesions like stye or chalazion, or conjunctival degenerative lesions like pterygium or pinguicula. You can get a case of conjunctivitis or corneal ulcer or entropion or ectropion. So these are some small simple cases, and it's a good idea if you make notes of them prior, because you know which short cases to anticipate. Now, whatever you learn for your practical exam, be sure that these certifiable skills that are there for ophthalmology, you are very well versed in them, because they can be applied anywhere. We expect that the student should know how to instill eye drops. Now, the eye drops can be required to be instilled for a corneal ulcer. They can be required for a patient with conjunctivitis or a patient with iridocyclitis, or sometimes you may yourself need to put eye drops. So you have to be thorough in some small basic procedures that are listed in these certifiable skills, so that in your own clinical practice as an intern or as a student, or even at your own home, some of these procedures you can do with confidence. You have passed the ophthalmology subject with flying colors. You are studying in your final professional, and now you have to prepare for NEET PG. But everybody is so overburdened with medicine and surgery, and by this time you have forgotten the basic sciences, so you want to revise all these subjects, and poor ophthalmology, which carries the tag of a minor subject, is sometimes ignored. We acknowledge that, because you get only about 15 questions out of 300 questions that you get in NEET PG for ophthalmology. But mind you, you can score absolute perfect score in these 15 questions if you adopt a focused approach for just about 7 to 10 days. A few number of days, a few questions should not be a deterrent. If you remember the movie 300, those 300 people could fight such a big army and could win. So you can fight a big score otherwise in your NEET score with just these 15 solid questions. If you ignore a minor subject, 1 or 2 questions make an entire difference. So try and score the best in small subjects. So in 7 to 10 days, how do you divide your days? Make a study plan. Decide which MCQ book or which clinically oriented book, which has all these small facts and factoids in a very promptly legible manner that you want to follow. You try and execute the plan to the T and never deviate from it, because you just have a week to prep it. On day one, when you get started, let it be the skimming phase. Just have a look at what all is to be read. In your mind, make a plan that I'll give 2 hours for this bit, 3 hours for this bit, I'll take a break now and then get back to studying. And in day 2, going on till day 7, you study and solve MCQs. Now, there would be many MCQs that you will not be able to solve. At night, before you go to bed, have a look at the MCQs that you were not able to solve. Now, usually we have a tendency to go and fall back on things that we are able to do well, and that gives us confidence and maybe some false joy. But it's a good idea to go back to things that we were not able to do, so that next time when you encounter them, they would come in your you were able to do category. Revise your newly acquired knowledge, and then you would be able to retain it. Okay, so from ophthalmology, you have moved on now to studying ENT. But in the first couple of days of ENT, at bedtime, give half an hour to the questions of ophthalmology that you were not able to do well. And that will help in retention of this so-called not able to do category section. Whenever you are studying, highlight the keywords, highlight the important facts and factoids, and try to make your own mnemonic, something fun that you will remember. Try and associate some entity with some object that will make you remember it better. Focus on the case vignettes. Now, case vignettes are very important. Ropey discharge is a case vignette for vernal catarrh. Spring is a case vignette. Pollen grains is a case vignette. So just try and remember the case vignettes, because these days in NEET PG we get clinically based questions, and these case vignettes help a lot in that. Focus on the past papers for trends. The trends is what is important. You are not going to get the same question next year. So for example, there was a question on, say, posterior subcapsular cataract, and the patient had been taking steroid drugs for that. You know that the question was not for a simple cataract case, and there was some element that was involved. So the next year probably they will ask about a patient who is diabetic, who is having a sugar cataract, and then they will ask you a little bit about how the sugar cataract developed. So you see, there is a trend as regards a particular different type of named cataract, and you have to figure out the causative agent for that cataract. So try and focus on the trends. Mark your incorrect questions with a separate marker, which is different from the ones you're using for a correct question. Read explanation in details for questions where you goofed up. Once you know what was the reason that you goofed up, you will remember it, you revise the thing till it becomes concrete in your head. And this revision bit for goof ups just takes 5 to 10 minutes. It's just a state of our mind that tells us to avoid our failures. So please focus a lot on your failures, because there are no shortcuts to success. You always cover your weaker topics first, and once you are thorough with them, then you can go on to simpler topics and the ball will roll really very fast. If you do the easier topics first, the things will be fine. But when you come to the tougher topics, you are already feeling exhausted that, oh, I don't know this. Will I be able to do any further? So once you have done the weaker bit first, you are there with a new zeal, with a new confidence of, having a victory over the tougher things. And then the easier ones will definitely go on for the roll. Read from the latest source. Have a knowledge of the latest guidelines, latest classifications, latest drugs, because the world is changing so rapidly. Things change so fast. What I used to read in KD Tripathi at the time I was doing my pharmacology, almost a zillion drugs have been added after that. So please be up to date with the resources that you use. Now, with all this in mind, what you should expect from the e-learning module that we have ready for you. We are focusing on some of the basics, and trying to weave these basics with clinical cases and some clinical vignettes. Now, in this 45 or 50 minutes lecture, we cannot do an absolute justice to the topic, but trust me, an attempt has been made to give broad guidelines for each entity that will make you wonder a lot more about that entity so that you can go back and study those in much more detail. There are certain case scenarios, there are lots of images, there are lots of fun anecdotes also associated with these images so that they stay in your mind. At several points, we have alerts for MCQs, for short notes, for long answer questions. And all this will encourage you to ask the question why. Why is the lens not transparent in elderly? Why is this happening to this patient? And then you can go back and dig in detail about why. So my idea as a teacher is to develop in you this zeal to study this subject much more than you would have just done it from your book. So with this, I hope you enjoy the e-learning module on ophthalmology. Thank you very much for your kind attention, and I hope you will learn this subject with the newer ideas, with newer concepts, and have some fun even with the new tech tools that are available. Thanks once again, and all the very best for not just ophthalmology, but all your subjects. All the best.